The topic of discussion is ancient or the classical research methods. That means it is regarding the research is existing or research was existing in Ayurveda and research will exist in Ayurveda. This is presented by myself, that is Professor Dr. Deshpande, and this is my mail ID and mobile number. Actually, we have already completed some first 8 slides, but as this topic is very important, just to revise the previous 7 slides, I have opened from the first slide. The question may be asked in the viva or the oral, that is, what is the research, and describe the ancient research methods or the classical research methods. Okay, so this is answer you will find in the book published by the Manikarnika publication Pune, edited by myself, Dr. Deshpande and Dr. Anade, and the name of the book is Research Methodology and Medical Statistics. You can definitely find these books in the Pune, Maharashtra state. So there the chapter 5 is regarding this particular answer. So first you must understand Ayurveda is not only medical science, this is the life science, and this is definitely, whenever any science we say, it is based on the research. That's why my claim is that in Ayurveda, research was there, research is there, and research will be there. Because research is always based on Pramana. Very important word, you can write down the word Praman. So what is actually the research? Re plus search. Re means again. So we have to gain the knowledge. Here you can see, this is a systematic gaining of the knowledge. Systematic. Not only gaining knowledge, but systematic way. And gaining knowledge process is not a one-time process. You have to go again and again, thinking of the objects, thinking of the events, thinking of the activity, and then we can find out something new. So research is always based on Praman. See my cursor. Praman in the modern language, Pramana means proof and Pramana means evidence. So here, Pramana is evidence. So Ayurveda is, if Ayurveda has a Praman, Ayurveda is evidence-based science. Remember this word, write down this word. Ayurveda is evidence-based science. Okay? So Ayurveda is based on Satkaryavad. Satkaryavad. What is Satkaryavad? Cause and effect relationship. Ayurveda do not say that anything magical is happening, spontaneous is happening, sporadically happening. No. Whenever anything you find in the world, in the human body, in the physiology, in the pathology, in the medicine, there must be some cause and there must be some effect. Like for example, now the corona pandemic is going on, and that's why Professor Deshpande is taking these online lectures. So whenever you find that the person is suffering from corona infection, there must be some cause. Either he may have been in contact with the corona patient, he might have been traveled to the foreign countries, and from there he has got that infection. So without any cause, automatically that corona infection will not come into your body. Okay, so that is called as evidence. So 4 pramanas are there in Ayurveda: Pratyaksha, Anumana, Aptopadesh and Yukti. Pratyaksha is a direct knowledge that we get it from our sensory organs. Eyes, ears, nose, tongue, skin, these are the, in Ayurveda also, they are called as a Jnanendriya, which gain the knowledge. And research is nothing but the gaining the knowledge. So we use this pramana. Then Anumana. The next is a Anumana. Anumana is a logical inference. Then next is a Aptopadesh, authentication. These particular points I have already discussed, so I will go a little bit fast. From the 8th slide, I will go a little bit slow because this is already covered in my last lecture. Yukti, that I have also talked, Yukti Praman, is like a conclusion or the result drawn after considering lot of variables. I purposefully using this research language. Variables are different, and based on these different variables, you have to draw the conclusion. For example, again, repeatedly I am taking the present example. How the doctor can diagnose the corona patient? Yukti Praman. First, they observe the patient that he has a cold or rather cough. Okay, high fever is there, dry cough is there, and of course, the breathlessness is there. Then they ask the history. Okay, then they say, yes, he has traveled to the foreign countries. Then they take the throat swab. So many factors: clinical examination, history taking, and the investigations. These all the three things, these are called as the variables. They mix together and then doctor makes the final diagnosis. That making the final diagnosis is nothing but the Yukti Praman. What we use, or rather what is used in Ayurveda since time immortal, 5,000 years back. Our scientists, Charaka, Sushruta, Vagbhat, they were basically using their 5 sensory organs, because all the people have developed a skill, to make the mastery in getting the knowledge through the senses. So Shrotra, ear, which is very useful to pursue the knowledge regarding the sound waves. Tvak is regarding the tactile sensation. Chakshu, eyes, are regarding the optic knowledge. Your rasna, Shrotra, Tvak, Chakshu, Rasana, that is a tongue. It is related with the taste perception. And Ghrana, that is nose, it is connected with the odor or the smell perception. So these are the basic material that we have for the research since time immortal. Anybody cannot take our these natural, what you can say, the resources. Now we have the different gadgets. We have the electronic microscope, we have the different scopies. Remember, these instruments are, write down, these instruments are extension of this material. Basic material in the human body is sensory organs. And whatever the gadgets, whatever the instrument that we are using, it's applied part. Is an extension at a practical level. But what is the Siddhant in Ayurveda? Any knowledge, any research should be done with the help of 5 senses. And nothing has been changed till today. Now, role of mind. Mind, as you know very well, it's Ubhayendriya. That means it is related with the Jnanendriya. It is also related with the Karmendriya. Sensory perception is there, and then some analytical work is going on in your brain. So brain is called as a supercomputer. It is a central processing unit. And then it does some activity with the motor system. So sensory system, motor system, connected here, CPU is there, mind is there, and it has a different steps. It has a different steps to acquire the knowledge. So they have the Chintya, Vicharya, Uyya, Dheya, and Sankalpa. These are the different steps of acquiring knowledge or confirming our knowledge which we pursued from the Jnanendriya. Chintya, Vicharya, Uyya, Dheya, and Sankalpa. On one day I will discuss only on the mind. At that time I will explain all these things. But at the moment, what I want to give you, I want to give you that what are the ancient methods of research in Ayurveda. So we will talk about Pratyaksha. How they use the sensory organs for direct perception to acquiring the knowledge. Sushruta is a well-known example. He at that time, first time, did the dissection of the human body. And then he has got the different structures of the body by dissecting the body. Everybody knows this history of Ayurveda. And in that history, who is a Sushruta is called as the master of surgery. And he first time made in the world the dissection process of the human body, and he find out the different macro and micro structures of the human body. So it was at that time, it's a research, acquiring the new knowledge. Before that, there was not knowledge about the human body, such a detail. Saptakala, layers of the skin, nobody was knowing before Sushruta. He first time invented that particular thing by the Pratyaksha Praman. Next, it is explained in the Sushruta Sharirasthan. So anybody is interested, they can open the book of Sushruta Samhita. Anguli Praman. You know this, Anguli Praman is measuring the measurement of the human body. Measurement of the human body, like Ayam, Vistar, and Parinam. That means length, breadth, and circumference. Length, breadth, and circumference of different body parts are mentioned in Ayurveda. What is that? That was a research. Now we are talking about the ratio of the weight and height. But at that time, with their language, research language, they mentioned if the human body has the same ayam and vistar, and if it is going to the 84 angula, then that person can be supposed to be ideal body structures. I think some concepts some modern doctors may not understand, but at least they should understand that there was some mention about this particular length, breadth, and circumference of different body parts, and it is mentioned in Ayurveda. Similarly, we are talking about Praman. Praman is a proof. Doses of the different medicines. For example, whenever we talk about medicines, there is definitely some measurement has been given. At that time, the measurement was mentioned as a gunja. So 1 gunja, okay, tablet is of 1 gunja or the 2 gunja. So gunja is equal to 1 gunja is equal to 125 milligram. So naturally, our scientists, Ayurvedic people, were asking to us to give this tablet, 2 tablets, 3 times in a day. Okay, something like that. So all these measurements were there in Ayurveda. Next is a Praman evidence or the proof is Anuman. What is Anuman? Logical inference. For example, I have quoted, every time I have quoted some examples of research. Agnim Jarana Shaktya Parikshit. Can you see my cursor? Agnim Jarana Shaktya Parikshit. Our digestive fire, our digestion capacity can be decided, rather our Agni or the digestion capacity can be decided by your digestion or assimilation power of your body. How much time you take to digest the previous food that you have taken. Suppose you have taken the lunch at 12 o'clock. In how many hours that lunch is at least partially or 75% has been digested. So there are some parameters are mentioned how we can judge that particular digestion process. Okay. So modern science also has some finding. They say, see the tongue of the patient. And then you can diagnose that his digestion is okay or not. Coated tongue. So this type of the terminology is also there in Ayurveda, in modern science as well as in Ayurveda. So this is nothing but the Anuman or logical inference. Another thing, Balam Vyayama Shaktya Parikshet. If you want to test a physical strength, that can be determined by capacity of exercise. Simple thing, your heart bala, strength of the heart muscle, even today, I'm talking about today's medicine, okay? So today also, when they want to test your heart capacity, heart muscle capacity, they ask you to do the stress test, treadmill test. What is that? They are not directly looking into the heart muscle like 2D echo. When they find there is some problem in the ECG after exercise, then they decide, okay, there may be heart weakness. And then they go further for 2D echo. But Ayurveda, in this 4,000 years back, BC, they have also mentioned that Bala or physical strength, physical endurance can be tested by Vyayama Shakti, exercise capacity. Nowadays, in the sports medicine, they are using Harvard step test. Harvard step test to decide the cardiopulmonary endurance. Harvard step test. But this particular test has a principle in Ayurveda. What is the basic principle mentioned in Ayurveda? Balam Vyayama Shaktya Pariksha. Next, Yukti. What is Yukti? Decision made by considering the different variables. Patient diagnosis is made by 3 Vidha Pariksha. Darshana, Sparshana and Prashna. Darshana, of course, inspection. Sparshana is a palpation and percussion. These are the modern terminology. This is the ancient terminology. And Prashna has 2 meanings. Interrogation and history taking. So all these things were there, and considering total scenario, as I have given the example of, already have given talk to you about corona diagnosis. First they see that the patient has cough, fever, breathlessness. Then they ask the history, and then they do the investigations, throat swab. So together they make the diagnosis. That is nothing but a yukti. And Ayurveda has already explained about this yukti by darshana, sparshana, prashna, and considering holistic approach of diagnosis. Aptopadesh, authentication of information and knowledge. That is most important. And that's why even today, literary research is supposed to be very important. But at the time of Ayurveda, ancient time, cross references always taken. Bhagavata has taken the references from Charaka, Sushruta, and contemporary sciences like Charak has taken the references from Sankhya, Vaisheshik. So this is the common method at that time also to collect the information from different sources of knowledge and then make our own opinions. So this is called as a cross references in Ayurvedic Samhitas. And Sushruta has clearly mentioned the importance of this literary research. What he says, Ekam Shastra Madhyano na Shastra Vinishchaya. Tasma Bhushrutam Shastram Janya. You should not depend on this type of the horse attitude. Thapad लावल्याप्रमाणे चालू नका in Marathi. You have to be consider all the variables, all the knowledge spread in the different sciences and collect this science of physics, chemistry. For example, today we are using USG, CT scan, what MRI. That is not the monopoly of allopathy. This is the development of biotechnology, and we can take the use of biotechnology to conclude our references, to conclude our knowledge. Okay. Symposium and seminars. This is one of the great assets for the research. Symposium and seminars, and there at that time used to take the different seminars. Samhita Granthas has a lot of references. One example I have given you. Rasa Aushadhi was there to decide the test, TASTE, by tongue. So different papers by different sadhus, by different acharyas, everyone stand up and he says that there is only one verse. Second scientist stood up and he said there are two tests that the human being can pursue. Third scientist get up and he said there were presented the paper and he said there are three tests that the tongue can pursue. But afterwards, finally, the higher authority conclude, no, there are finally 6 tests. But this determination of 6 tests was done after gathering of the different scholars together. Symposium, conference was held, and then the decision was taken by the higher authority. Okay, consensus was done. Research based on observation. This is most important at that time. See the different examples. One-time observation, instant one-time observation. Duration of research, we have to mention how much duration of the research. So this is a one time to decide the rasa of substance. What Ayurveda says, if you want to decide any test of any substance, especially non-poisonous, put it on the tongue and see the feeling, get it test, whether it is a madura, amla, lavana, katu, pitta, kashaya, sweet, sour, salty. So that is a raso nipate. Nipate means to put that particular substance on your tongue. That will give you the idea about a test. That is called as a one-time observation. Next, duration of research. 1 day observation. Madhura, amla and katu vipak. Vipak, madhura vipak, srishta vitamutra. This is the effect of that madhura vipak. Vipaka is a post-digestive test. Vipaka, after primary digestion, Sarapitta Vibhajan, whatever the test that particular substance has achieved is called Vipak in Ayurveda. Post-digestion, primary digestion, converted test. So, because of the Madhura Vipaka, the patient gets normal bowel and micturition without any problem. But if it is a Katu Vipaka, the patient may get the problem in the bowels, may get the problem in the urine. How they can make this statement? After research. And that was research, duration was whole 24 hours, that decision was taken. By observing the people, observing the patients, many days observation, virya. How the virya is decided? Adhivasa. That means that particular substance, when remain in the body for a longer time, 4 days, 8 days, 15 days, and what is the effect on the body? Whether it's a cooling effect or whether it is a burning effect. Shita virya or Ushna virya. Cold effect or the hot effect. For example, Gulkand. Now this April 2020, May 2020, we are suffering from heat, summer season, Grishma Rutu. There, if the person takes regular, every day, 2 spoons of Gulkand, that is the rose petal jam, he feels little bit cooled, chilled. He do not get much trouble from the heat of the sun. That is called the Shita virya. Ushna virya, For example, bhallataka. Bhallatak is supposed to be very hot in potency. So if somebody takes the bhallataka for the longer period, he may get little bit burning in the chest, burning in the abdomen. But virya can be decided after few days or few months. Many months observation. Guru, how the Guru Gun is decided? Yasya bruhane karmani shaktihi sa Guru. If the person is taking the wheat or the mash or black gram for a longer duration, the person is supposed to be increased in the weight. This is the research. This is based on the observation. But what is the time of duration of research at that time in Ayurvedic time? It takes months together to decide the effect of Guru, Laghu, Shita, Ushna, etc. Now Laghu, Langhane Laghu. So if we ask the obese people to take the rice flakes, that is Laja, or the green gram, Mung, if we ask the patient to drink the warm water, eat only this type of the food stuff, gradually in the month you will see that he has lost 1 or 2 kgs. But that research is depend on longer duration. Now many years observation. Vega and Avega Avastha in many diseases are mentioned in Ayurveda. How they could mention that exacerbation and remission in apasmara, in epilepsy, there is up and down. Vega Avastha is there. In Shvasa Vyadhi, bronchial asthma, our Charak has mentioned they have the Vega Avastha and Avega Avastha. How they could mention? Based on research. They have observed the patient for many years and then they have decided these particular things. Now, research based on observation, for example, test decision. Katuras. What are the symptoms? What are the clinical features they have mentioned? Jivva agre chimchimayati. Here, whenever you eat some spicy food, there is some irritating feeling at your lips and the tongue. That has been mentioned in Sanskrit, Jivva agre chimchimayati. This is the observation, this is the research. If you eat the kashayaras, amala, akshi bhuvam sankochet. Something sour, something astringent you take and your eyebrows, something contracting. This is something observation. Based on the observation, they have decided the parameters. Okay? Nadi Vijnana. Vata Nadi, how it is mentioned? It is a Sarpagati. So they have observed the environment. In those days, in Ayurvedic days, all study material, all the education system was based on the interaction with the nature. Always, they are very close to the nature. That's why you will find lot and lot of references from animal kingdom, plant kingdom. So they say, how is the Vata Gati to teach to the students? They give the examples of Vevi, Sarpagati, like a snake. Snake is moving like this, you know. Sarpagati. So it's a arrhythmia, not a regular straight line. Arrhythmic condition has been mentioned by Sarpagati. This is research. Pitta Nadi is like hopping, like the frog. Frog is hopping, Manduka Gati. So this hopping type of the phenomena, picks. In the wave graph, there will be picks in the Pitta Nadi. And Kapha Nadi is mentioned as Hamsa Gati, swan. It's very slow and rhythmic, very slow and rhythmic, very slow and rhythmic. So this is the Kapha Nadi mentioned in Ayurveda by the research. Research, another method at that time, ancient times, trial and error method or crossover trial. Gudalingam Vyadhi, Upashay Anupshay Bhyam Parikshet. This is the quote mentioned in Ayurveda. This is the Siddhant. Gudalinga Vyadhi. Whenever your diagnosis is not perfect, you have to do trial and error. Trial and error method. Trial and error method, Upashaya, relief, and Anupashaya, problem, not getting relief. So based on relief and non-relief, you have to diagnose. In Vata diseases, for example, suppose I am having the pain at the elbow joint, okay? And usually Vata treatment is applying the oil, Snehana. If after applying the Snehana, my pain increases, although it is Vata, but pain has been increased. Sandhi Vata, joint pain. Why? Why that is that? Because Vata Prakopa, Ayurveda was knowing that nerve conduction can be damaged by 2 things. Number 1, with the obstruction, coronary obstruction, like for example, or there may be degeneration, like myelination, demyelination. multiple sclerosis. In both the conditions, current is disturbed. So Vata kinetic energy is disturbed by either obstruction or by the deficiency. So when there is a Vata obstruction, your oil application will increase the Samata. Obstruction will be increased. Samata, Ama is a toxic material. That obstructive phenomena is there. So doctor has to change the policy and he will give the 3-2 tablet. That is the Deepana and Pachana, and then he will ask to apply the oil. So this is the change. Now, animal experiments was there in Ayurveda, ancient science. Visha Pariksha, poisonous food consumption shows changes in activity of the animals. That is very well mentioned or very well taught in the Agada Tantra, toxicology subject. In Charaka, there are some chapters, they are regarding Vagbhat, he has mentioned about how to examine the poisons. So, for example, croc or the peacock, these animals have been changing their voices or activity. Interested people can go there and open the books and see the details. But animal experiment was there with that particular toxicology subject. Then Madhumeha, diabetes mellitus. It has been mentioned in Ayurveda that urine, that particular urine of that Madhumeha patient attracts the ant. And this ant creature is attracted towards the sweet. Everybody knows that. Whenever we put the sugar or the jaggery, all the ants come. So they have mentioned that Madhumeha patient's urine attracts the ant. That means that urine has a sweet taste. That nothing but the glycosuria. So glycosuria was diagnosed at that time by these animal experiments. And then they have written, yes, they have this condition. Next, classical and contemporary research. Classical means ancient and contemporary means present. It is just comparison for your understanding. Ancient Ayurvedic research mainly based on vivo trials. So you must write down these two words, vivo and vitro. Vivo and vitro. Vivo means in the human body and vitro means in the laboratory. Do you understand? In the laboratory. So previous ancient research was mainly based on the in vivo trials, and modern research is mainly based on in vitro trials in addition to vivo trials. I'm not saying they are not doing clinical researches, but their major emphasis is on the laboratory testing. Ancient Ayurvedic research, keen observations of the healthy person, patients, events, analysis of the data collected, and conclusion was made. Modern research is more experimental. They use the more gadgets or the instruments. Ayurveda is the eternal science because what is the meaning of eternal? Shashwata, time tested. Ayurveda was there in past, Ayurveda is there in the present, Ayurveda will be there in future. This is only because of fundamental principles of Ayurveda. And these all fundamental principles are where and will be rather based on only and only research. So we all should be proud of these fundamental principles of Ayurveda, which are called as Siddhant in Ayurveda. Loka Purush Samanya Siddhanta. Nature and human body has a relation with with structural relation and also functional relation. Sarvam idam panchabhotikam asmin arthe visarga adana vikshepaihi soma surya anlayatha dharayanti jagat deham kapapittanilastha. Panchabhotik Siddhanta. Dosh dhatu mala moolam. This moolam means roots. Dosh dhatu and mala are responsible for creation, maintenance and destruction of the human body. Samanya Vishesh Siddhanta, principle of homologous and heterologous. Sat Karyavad, cause and effect relationship should be understood. Okay. For example, coronavirus is directly connected with the touch, droplet infection. So this is Sat Karyavad. Try to understand. Kalartha Karmanam Yogu. Next. Kina Nitya Atimatrakaha Samyak Yogascha Vidneyo Roga Rogascha Karana. This is the three root causes of disease. Kala, Artha and Karma. Kala means seasonal factor. Artha means Indriyartha. And Karma means activity. So Kala, Artha and Karma, if they are in a homeostasis, balanced, optimal, it's good for health. But anything excess, low or abnormal, that is bad. Kala, artha, karma. And which are the three types? Hina, mithya, and ati yoga that can cause the disease. Then rogastu dosha vaishamyam, dosha samyam arogata. Equilibrium, homeostasis is health, and imbalance is a disease. This is the Siddhanta of Ayurveda. Now, what is Siddhanta? Siddhanta means Siddhanto naam sa yaha parikshakair bahuvidham pariksha. Try to understand. Parikshakair bahuvidham pariksha. It is always done a lot of tests, lot of observations, lot of experiments. Bahu, shabda, bahu means many. Many observations were noted. You understand? Many symposium conferences were taken. Many experiments were prepared. And then only Siddhanta has arrived. And Hetubhishcha sadhitva nirnayaha. So Siddhanta is nirnay, conclusion. In our research word, nirnay means conclusion, final conclusion, based on observation and discussion. Write down this word. Always our conclusion is based on observation and discussion. Same was there in ancient times. The Siddhanta has been prepared after multiple observations, multiple experiments for a short duration to the long duration, and then they conclude that this may be after discussing, clarifying the cause and effect relationship. Okay. So, what is Siddhanta? This is Nirnaya or the conclusion. After Bahuvidha Pariksha, by following a lot of different research protocols. This line is very important. My dear friends, we are talking since last 30 minutes regarding research methodology in ancient science. Research methodology was existing. I'm saying was, exist. Of course, this is existing today also. But at that time, we are trying to use a lot of proofs. I had given you a lot of examples how this is true that research was existing at that time. So that is a Bahuvidha Pariksha by following lot of different research protocols or examination methods. Okay, so we can observe all these things in Ayurvedic science. Research is equal to progress. Research is equal to progress, or progress is equal to research. These are the synonyms, these are the parallel words. So research is always progress, and for progress we need the research. How the progress was there in Ayurveda? How the progress was there in Ayurveda? Charak has mentioned only 5 types of Vata dosha: Prana, Udana, Vyana, Saman, Apan. He has not discussed about the Pitta types and Kapha types. Then Sushrut came after Charak period or something parallel. Sushrut came and he made the progress in understanding. He explained types of Vata dosh plus types of Pitta dosh. Sushrut has mentioned Pran, Udan, Vyan, Samanapan, and Pachakagni, Ranjakagni, Bhajakagni, Sadhakagni, Alochakagni. Of course, he used the word Agni, but that is the same like Pitta. Agnireva Sharire Pittantargata. Agni is energy and Pitta is a matter. Energy and matter, physics word. So energy and matter work together. Then came Vagvat. After Charak Sushrut. He has mentioned Vata types, Pran, Udan, Vyan, Saman, Apan. He mentioned 5 types of Pitta, Pachak, Ranjak, Bhajak, Sadhak, Alochak. And he has also mentioned 5 types of Kapha. Okay? Kledak, Bodak, Avalambak, Shleshak, Tarpak. Is it not progress? Step by step, with the period of time? And that's why there was research, because there was progress. Another examples of progress. Drug development. Can you see? And the olden days, there were only herbal medicines. But in 11th or 10th or 12th AD, what happened? Rasa Aushadhi came. It's a formation with the mercury and sulfur. Why did the development of Rasa Aushadhi? They clearly mentioned that compliance of the patient. Because it's very, nowadays we also accept that it is very difficult to take the powders of the herbs. But if we made the tablets, And if the tablets are added with mercury and sulfur, they are yoga vahi, catalyst. So action is very fast, easy to take, shelf life that can be preserved for a longer time, and it is also fast action. Still today, the development progress is going on in Ayurveda. For example, avian company of Kerala. In Kerala, there are practice of using the decoctions. But now they have also understood to carry the bottles of the liquid is very difficult for the IT people, information technology people. It's very difficult to consume that medicine with the water. So they have made kashaya tablets, Balavruchadi kashaya, Dashamula Rishta kashaya tablets. So these tablets are available. Also, Sukshma Aushadhi, this is a new development. Even today, some Vaidyas are preparing. At my time, there was Agoma company which was preparing Sukshma Aushadhi based on the principle of homeopathy. Sometime I will tell you about that. Then ghee tablets are there.